Hello, everyone, and thank you for joining us today. This is our third online forum, and we are excited. Today, we'll be talking about opportunities in the climate and the health sector. How are these two related? You will get to know about that. We have our speakers right here who are ready to tell us more about this sector and the opportunities, the jobs, and even every opportunity that is actually available in this sector. So welcome, feel free to let us know, just type in your questions if you have any, and we will make sure that we answer all of your questions. We'll do our best to actually make sure that we do that. So in the chat, just leave a question if you have one. And yes, we will be answering all that. Our speakers are ready and they are capable of doing all that. I just want to hand this meeting over to Rispa, who will be moderating the session. From here, you'll introduce our guests and take over. Thank you so much. Welcome, Rispa.
Okay, thank you, Pauline. I hope you can hear me. I hope I'm audible enough. So I'm Rispa, as Pauline stated, and I'll be your moderator for the day. And I look forward to having an insightful session. You know, you don't have to be a doctor, you don't have to be a nurse for you to work in healthcare. People in communications, engineers, secretaries, everyone has a chance in the healthcare space. And that's why we are here to learn more. And even when it comes to digital health. And before we move on, I would just like to let you know that this is an hour session max. So it's 50 to 1 hour. And so that means keep time when you're given a chance to speak, or maybe I will interrupt you somewhere if maybe you take much time. But all in all, we look forward to having an amazing session. And like Pauline stated, if you have any questions, we have a Q&A session after the speakers are done speaking. And so have your questions ready, have them in the chat box, and you will get to know everything that you really want or any information that you need. And now I want to bring or introduce Teresa, who is the editor, Healthcare Rising, and it's a newsletter that does news reports, insights, trends, jobs about healthcare. And so she'll have a thing or two, and then we will proceed over to our other guests. We have Vivian Korir, who is a workforce transformation, edtech, and digital health leader with 15 years plus experience. And then we have Dwayne Assemble. He's the project manager at Shortlist. This is the third time we're having Dwayne. So Dwayne is our resident HR, and he always comes through with good insights when it comes to hiring, how you go about when it comes to job application. So yeah, over to you, Teresa.
Thank you so much, Rispa, and welcome again to the webinar. I am Teresa Michelle Atieno, and I am the editor for Healthcare Rising. And as Rispa has said, Healthcare Rising tackles the intersection of climate change and health. And most of the time we think that this intersection does not exist, but it does exist, because in many ways and almost in all ways, climate change affects the delivery of healthcare to people in different ways, rise of disease burdens. And also we have other ways to tackle this, and we have some solutions like digital health. And so today we are going to talk about jobs in the healthcare sector. And the idea that you do not have to be a health professional to work in the health sector. And some of the things we're going to look at are opportunities in digital health for the youth, and how they can get into this space and get upskilling opportunities, and also talk about other roles that will not need you to have like that healthcare degree or related degree. And one of the biggest examples is me, because I have worked in healthcare for over 6 years as a communication professional. And I did not study health, even though I had to do other additional courses throughout the way on health and science communication. But then when I started, I was just a journalist with a journalism degree. And I said, this is the only opportunity for me to get into healthcare because I cannot do a health course. But then I said, even as a journalist, I would get into this field. And so I am here 6 years later with lots of skills and experience in this field. And this is what essentially we are going to talk about. So welcome once again. Healthcare Rising also handles or curates jobs every month. So if your jobs, you can subscribe, but that will come later and you'll be able to get these jobs in your inbox. So back to you, Rispa, so that you can welcome our guests.
Okay, thank you, Teresa. Did you want to be a healthcare professional at first? Is that what you wanted to pursue?
Yes, yeah, I did. I did for many reasons. I wanted to be a doctor. I come from a family of doctors, and it is what I'm used to doing. So I got somewhere, and then you look at your grades, and you're like, oh, I might not get here. So I said, let me start with something else. And I'm still here. So I am still in the healthcare space in another way. And I am happy I'm here. And because a communication degree gave me the opportunity to still be in the healthcare space.
Okay, thank you, Teresa. So if you're in our audience and you wanted to be a doctor and somehow your grades didn't, manage to get to the cutting point, don't worry. Teresa is now a healthcare journalist, so you still have a chance. And now on to Vivian. Vivian, please take over.
Lisa, I think you may have to unmute Vivian.
Oh, okay. Hmm.
Thank you for that. Yeah, I was muted. So let me first introduce myself, then I'll take my video off, then I put my presentation on. So as mentioned, my name is Vivian Korir. I'm a health workforce, digital health and EdTech leader. I've been in this space for 15 plus years. I also don't have a background in health or health sciences, but really the last 14 years I've been working in health. So for what you're talking about today, I'm a true testimony that this is possible. So you'll allow me, I put my video off, then I'll share my presentation, then I proceed. Okay, confirm that my presentation is up.
We can
Yes,
see.
it is.
Okay.
Yes.
So I'll proceed. So I've already introduced myself, so I'll straight on move on to this presentation. We are really looking at what other career opportunities are available in health for persons without training in health or medical related fields. So there's the myth that for you to work in health, you need to be either a doctor, a nurse, a pharmacist, a physiotherapist, maybe a community health worker, have a training essentially in health. But really the reality is for every clinician, there are dozens of roles which keep the system running. And health per se is a system, and it needs people from every discipline. And as Teresa gave the example of communication, but for the health system to function and to run, it requires all professionals. So really, clinicians form a fraction of people working in the health sector, but the rest is me and you who don't have that background. So this is how the health sector is organized, or the health system. I've used the example of Kenya. So we'll start on the left side. Health services in Kenya are organized in 6 levels. From the lowest level, that is the community level, and this is the household level. So health really starts, or healthcare starts at home, at the household level. This is where we have preventive care. And in Kenya, we have community health promoters who work at that level. But across Africa and many resource-constrained countries, we have, they are called community health workers. And mainly these people have basic education training. Most have maybe secondary level training, and then they do some additional courses in health. So in Kenya, the Division of Community Health provides training for community health promoters. I think we have over 107,000 in Kenya. And this is an opportunity for somebody at the community level who thinks, how can I contribute at the community level? It's a recognized cadre. So with your high school training, and then with training from the Division of Community Health in Kenya, there are specific trainings for different countries. You can work at the community level and contribute to health at that level. Then we have primary healthcare services. That's level 2, where we have dispensaries. We have level 3, where we have health centers. Level 4, where we have sub-county facilities. Level 5, where we have county referral hospitals. And then the highest level in Kenya is the national referral and teaching hospitals. The last, I think we had 6, or the latest should be the 7th one, the Jaramogi Oginga. Then beyond the national, so in different countries, the organization varies. Some have 4 levels, some have 5 levels, but it is really flowing from the community to the national level. Then we have the regional level. So in Africa, we have the African Union and Africa CDC part of that. We have a WHO Africa Regional Office, East Africa Community, ECOWAS, and the likes. And then we have the global level. This is where we have WHO and development partners like the World Bank, UN with UNICEF doing a lot of work in health, Global Fund, and other partners. So this is how the health system is organized. And therefore, as we talk about careers in health, we don't limit ourselves to the country or the community level. It's all the way to the global level. And even the development partners have offices at country level. There's a WHO office in Kenya. There's a World Bank office in Kenya. There is, Gates Foundation office in Kenya, and other African countries. If you go to Nigeria, if you go to, other countries in South and Northern Africa, you'll find them. So who are the players in this space? We have the ministries of health who lead this, setting the policy. Then we have the subnational, whether county or district. We have the UN agencies, we have international NGOs, local NGOs, community-based organizations, and faith-based organizations. We have donors. We have the private sector, which really plays also a big role. And then we have individual contributors and innovators. So we don't have to be, in a formal institution. You can contribute individually as an entrepreneur, as an innovator, or as, as a consultant. Then we have the academic institutions. We cannot leave that. And then research institutions. So that is how it is organized. So where does your, training fit in? So I just picked a few, but really each and every background you have will get some space in health. For instance, if you have a training in teaching or education, there is learning and development, capacity strengthening, ed tech, computer science, digital health, informatics, cybersecurity. You can screenshot this slide. If it's science, maths, stats, there's data analytics, there's epidemiology, there's, biostatistics, business, health financing, operations, communication. Teresa has given us a good example. Aviation, there's air evacuation services, and then, cross-cutting like project management, resource mobilization, monitoring and evaluations, operation, coordination, administration, and then what I talked about, individual contributors, whether as a social enterprise, whether I'm sure the work Teresa and her team, the team from Healthcare Rising are doing is part of this. And also I have a social enterprise, First Elevate Africa is part of this, consulting and impact solutions. We have also, emerging areas like digital transformation, health intelligence data, cybersecurity, AI and innovation, and roles which keep the health system running, operations, procurement, finance, human resource management, partnerships, and so forth. So whatever your training is, you'll find a home in the health space. These are some of 3 areas which at times are not looked at as healthcare. Health insurance, for instance. We have social health authorities or social health insurance in our countries and UHC programs. We have medical underwriting, claims management, provider relations, actuarial support, and so forth. In Kenya, examples of Britam, Jubilee, the Social Health Authority, that's in the health space. Emergency services, so we have paramedics here, ambulance, air evacuations, and so forth. Then we have what Teresa talked about, health communication, right from social media content, graphic design, health campaign management, blog and website management, online community management. So all these are, in the health space, but you see, most of them do not require really a training in or a background in health or a medical background. Let's talk a bit about digital health. And digital health, or more often when we hear about digital health, people think about it as technology, but really it spans beyond technology. It's about transforming the health system, improving health service delivery using technology. So things like health data and information systems, mHealth, eHealth, community health tools, health policy and governance, e-learning and workforce development, interoperability, cybersecurity, all those are aspects of digital health. And as a youth, as a young professional, there are things you can do in digital health. So for instance, in digital health and health informatics, there's digital health specialist, health informatics officer, and then we have the common systems which are used in digital health, like DHIS2. We have ECHIS, which is used at the community level by the community health workers and community health promoters to deliver health. And we have the electronic medical records, which are the health systems used in facilities to deliver healthcare. If you're a software developer or product design, these are some of the things you could do. If you are in data analytics and AI, these are some of the things you can do in health. If you are infrastructure, cloud, and DevOps, these are some of the things you can do. If you are learning and capacity development, those are some of the things you can do. If you are interoperability and standards, there's some of the things you can do there, cybersecurity, digital communication, and innovation and entrepreneurship. So really, when we look at digital health, it still encompasses everything. And you can see this is not exhaustive, because if you go to finance, if you go to procurement, if you go to medical products, there's a lot of digital health application there. So really, there's space and there's work which can be done across that. And in Kenya, I can use, for example, the Digital Health Agency, which came into being a few years back, I think last year or the year before. It's a whole new, organization with a lot of roles. And if you look through those roles, you'll find that people from all, backgrounds are working there. We have the Social Health Authority. It's the same case. So also we can't miss to talk about AI, because AI is the buzzword. Everybody is talking about AI. But what we are really saying, you don't have to build AI. You don't have to be an AI engineer or specialist, but you need to know how to work with AI. So in health, we see it in diagnostics, we see it in clinical decision support, chatbots, disease surveillance, and personalized e-learning. But there are those roles which are specific to AI. So if you have interest in that and the background, then those are some of the things you could do. But also what is very important for all of us, young professionals, the youth, is to build AI fluency. And these are examples of free, open, available AI fluency trainings and courses out there. If you go to Kenya's ICT Authority website, there is a current call to persons, I think, below 35 years for an AI Champions program. There's AI fluency training by International Organization, I think, of Employment, Google AI Essentials, Elements of AI, and WHO AI for Health. This is just a few I've been able to pick, but I'm sure if you just type on your browser free AI or AI fluency courses, they're available. So it is also important that you build on this, but also understand in your profession, where do you apply AI? Certifications also give you an edge, because you find that everybody have the basic, maybe many people have the basic training you have, but the certifications will demonstrate initiative. It will help you stand out from other graduates. It will show employers that you're job ready. And therefore, if you're interested in digital health, DHIS2 Academy offers some of the DHIS2 trainings. OpenHIE, TechChange has a current call for the Digital Health Planning National System. For September intake, it's open, it's free, and they have their online course. Project management, things like PMP Pro, PMP Prints, monitoring and evaluation, MILD Pro, Kobo Toolbox, data analytics, Excel, Power BI, data visualization, research ethics, health informatics, courses, AI, I've talked about them, learning and development, instructional design, e-learning development. And if you're really interested in learning and development and ed tech, I'd also recommend Moodle, because that's one of the platforms which is used a lot for online learning. Communication and content creation, digital marketing, Canva, social media, strategy, storytelling. And for public health, we have the Open WHO courses, global health courses, and so many more free and open courses available. Coursera, edX, LinkedIn Learning, and so forth. So this gives you an edge. How do you enter into the health space? One is internships. So many organizations provide internships right from your ministries of health. So those are and that's a good entry pathway. Another one is volunteering. So you can volunteer to work in an NGO, a CBO, a faith-based organization, or your Ministry of Health. Short-term contracts. Occasionally or often you find that institutions in health recruit people for consultancy, short-term contracts. Maybe somebody is out for maternity leave or for study for some time. They take in people to do that. And those are some of the things you can take advantage of. We have organizations with graduate programs. So also, find out which organizations these are and take advantage of that. Very important, upskill. I've given an example of certifications you could take. Then LinkedIn communities. LinkedIn is a very powerful platform to build your online presence and to be visible. So this is your first job board. Can you connect? Can you engage? Apply, post, be visible, because organizations really want people they can verify, people they can see, people they can confirm. And one of the best places to show this is LinkedIn. So what the sector really rewards beyond and over your academic training is adaptability. Can you work across different contexts, cultures, countries, and systems? So flexibility is your superpower. Impact. So what are you there for? You're not just there to fill that job. What is your purpose? How does that align to the mission, vision, work of the organization? AI fluency. I've just talked about that. And lifelong learning. You have to demonstrate that you are, a lifelong learner, because the sector is evolving fast. And therefore, for you to stay relevant, valued, and promotable, keep learning. I'll share my journey to wind this up. So really for myself, I studied education, mathematics, and I did a Master of Business Administration. And I started as an educator and trainer. Then I got a role in an international NGO, an entry-level role in capacity building. I became curious about education technology, and through my own initiative, and of course on-job experiences, I mastered e-learning and Moodle. And I can confidently say I'm an expert, I'm an advisor in EdTech because of that. Then I transitioned also to digital health capacity strengthening through a role I interviewed for. Something about that role, it required a degree in public health, and I didn't have the degree in public health. But when I looked at everything about the role, it was matching my profile. The only thing which was missing was that degree. So I applied for it and I got the job. So I didn't discredit myself. So over time, I've worked in health system strengthening, health workforce, digital health, digital literacy. I've supported governments in over 13 countries, institutions of health, and health workers across Africa. So just proof that careers are not linear. If you did law, it doesn't mean you have to remain a lawyer. If you did a degree in agriculture, that you must work in the agriculture space. It means that careers are organic, and that initial entry point you get after graduation or as you do your studies could be how your career will evolve over time. So really, stay curious, take initiative, and say yes to growth. So from here, going forward, some of the things you could do is look at roles and the different sectors, and then match your background and skills and interests to 2 or 3 of that. Then go to LinkedIn, identify some health and development organizations, follow them, join a professional community, begin engagement, begin posting, commenting, reposting, and so forth. Be visible, build a profile, and then start learning. What course can you do maybe in the next quarter, which could give you an edge? So thank you very much. The health sector is waiting for you. The sector is vast. Your entry point exists. Stay curious and keep learning. That's a QR code to connect with me on LinkedIn. Let's keep the conversation going. Let's connect. And above all, I wish you all the best in your journey in health and development. Thank you very much.
Okay, thank you. Thank you so much, Vivian. I had thought the healthcare was broad, but I had not thought of aviation. I had not thought of a pilot working in healthcare. It's really, really broad. Maybe Vivian, before you go, I'd like to just ask you one question. what has been the highlight of your experience when you're in the healthcare workforce and the digital health space? What is one thing that has stood out so far?
Yeah, I think something about health is the direct impact you see in the communities and in people through the work you do. It's really rewarding because if you, for instance, deploy a digital health system, you can see real time the data collected, how it is influencing or informing evidence decision making, and ultimately improvement of health outcomes. If you implement a training, maybe in digital health, you can see how health workers are able to use those tools confidently and improve health service delivery. And really, I think that is very fulfilling, and really you can see the impact almost at a real-time basis.
Okay, thank you. I think I will now head over to Dwayne. Dwayne has been our resident HR for the longest. So Dwayne, welcome. And to start off, Dwayne, I have a question. It was asked on social media and I was told I have to ask this question, and I hope whoever sent it has attended the webinar. And so someone asked, what are the areas that not recruiters, what are the areas that people who are looking to be hired or people who are looking for job opportunities struggle the most when it comes to the hiring process? And yeah, Dwayne, you can take over, but remember that question.
That's it's a huge question because not everyone has the same struggles. I guess maybe the thing I see the most common is at interview stage, showing genuine interest for that organization you've applied to and the role, right? So you've gone past, we've seen your CV, everything is great, but then when you get into the interview with the hiring managers, lately a lot of what I'm seeing or hearing is people aren't doing research on that organization or what the organization is about. So I'd say that would be a key area. And then perhaps not, how do I put it? So before the interview stage, I think maybe one of the struggles is just translating or rather highlighting your transferable skills. And this is why you hear a lot of us say you need to tailor make your CV for every role. But that doesn't mean you copy paste what the job description says. But tailor making your CV helps you stand out, helps the ATS. If someone is using advanced search on their ATS, they can pick up similar words similar to what's on the job description. So I think that would be the two areas: just tailor making your CV and showing genuine interest in the organization you are being interviewed for or you've applied to. Respect, if you're talking, we can't hear you.
Yeah, I just realized I'm sorry. I hope you can now hear me. So I'm seeing a question. Someone is asking, please keep the questions coming on the chat box. Someone asks, how did you get shortlisted with a Bachelor of Mathematics for public health role? Some of us can't apply where our courses are not listed. This one goes to Vivian.
Yeah, thank you, Tim, for that. So yes, I have a bachelor's in Bachelor of Education in Mathematics. So as I mentioned, my entry point was a capacity building role, entry level. And it was because mainly, I think, because of the education background. But really, with a degree in mathematics, there's health data analytics, there's biostatistics, there's public health research, there's monitoring, evaluation, and learning. There are those cross-cutting areas like project management, administration, and so forth. At times, when you look at a job, I'd advise don't only look at the degree required, then you stop there and say, I don't meet this. go ahead and read the other requirements, because you'd rarely, okay, you can find people who meet a job requirement 100%. But I think if you are 60 and above, and we have somebody here from shortlist, maybe they can advise on that. But usually if you tick most of the boxes, go ahead and apply the job, because really it's the interviewer on the other side who will decide whether they want to shortlist you or not. But from your side, don't discredit yourself. But also I've given some entry, areas like volunteering, internship, short-term contracts, and so forth. Identify an institution of maybe a community-based organization and say, I want to learn about public health. Can I work here for the next 3 months or just to learn? And that is something on your CV and can give you that entry pathway. Thank you.
Okay, what I'm getting from Vivian is, above all, have the drive. As much as you will be applying for opportunities, also go out there and look for the opportunities and tell people what you can offer, what skills, what value you're going to offer. And Dwayne, there's something that Vivian mentioned, that if you have 60% qualification, that would be enough when you're applying for a job. Is that so? Is 60% enough? And then there's another question. Which is the most creative way to stand out as a candidate? Do I highlight my talents? Do I highlight my superpowers of things I can do? Or how is the most unique way or the creative way to stand out?
I'll start with that one. I think it's recruiters, we love achievements. We love to see what you've done in the job, what you've solved, even if you're an intern. We love those more than responsibilities. So that's a sure way to stand out. Of course, if you're applying for a creative job, if it's graphics or content management, show your portfolio, show your actual work. If it's work that you're applying for something that's visual, I would say show your work. If you're in software development, people usually put their GitHub link, but we love to see achievements and a clean CV. Excuse me. And then another way to stand out is to reach out to if a job is posted and the recruiter on LinkedIn and the recruiter has put their profile, feel free to reach out to them and ask for a conversation. I know people get awkward about it, but also your messaging has to be very intentional. You're like, hi Rispa, my name is this. I saw this role you posted. I applied. I've attached my CV here. Happy to have a conversation at your earliest convenience. So you're not emailing to say, hi, I applied, and that's it. Or, hey, how much? That's another way to stand out. I've hired someone who actually messaged our boss on LinkedIn, our CEO, and he forwarded me the profile. And I was like, I would never have messaged any CEO at all in all my life. So that bravery. But yeah, achievements, put yourself out there. Back to Vivian's comment, I think one thing that's really important, as Vivian has touched as well, is despite not having the degree, she had the sector experience, right? And she started at whatever level it was without needing to be. So if I was a recruiter and looking at her profile, I'd look at the things she's done. I wouldn't look at the degree. And lucky for her, or actually intentional on her part, she made sure she was in the right space at the sectoral experience. The 60% thing, I wouldn't put a percentage to it. I mean, obviously, if you're an accountant and you're applying for a software engineering job with no background, then we are done, right? But you could be an accountant who's done a software engineering course and you want to switch careers. I look at that first, and then I look at the projects you've done. So it depends on the level as well. If you're entry level, I'm not looking for like a percentage of what what you hit on the CV. I'm looking at transferable skills. But back to also what Vivian said, you never know. Again, by that I don't mean that you're applying for CEO and you just graduated. But you never know. If there's one thing, if it's just like one thing that's kicking you out, if it's the degree or one thing you've not done, send it through. Highly unlikely there's everyone with everything. And even if there's someone in the pool who has everything, you never know. They might not be within their budget. They might be interviewing multiple times. So if it's one small thing like, oh, I don't have the right degree, but I have everything else, do it. Send the application. Or I have 50% of these and I don't have the other 50%. A good organization will train you on how to do the other 50%.
Okay, thank you, Dwayne. I'm seeing someone asking, good afternoon. This is Kennedy Owino. Good afternoon. Apologies for joining late. Could you clarify if the discussion is focused solely on healthcare or it also extends to healthcare safety and environment? I think it extends to all the aspects of healthcare. We really had such a great presentation from Vivian. I'm sorry, Kennedy, but we will make sure to email it to you. There was such a great presentation, but you will have it, so don't worry. It's just not healthcare. It's exploring the different job opportunities in the healthcare sector, including AI. There was even pilots, so it's broad. Keep the questions coming. I am seeing another question here. I think this one is to Vivian. Someone is asking, is there any roles that you can pick that has been growing so fast that is not necessarily doctor? I think it's any non-medical role, Vivian, that you can pick or that you have seen over the years that has stood out.
I wouldn't point a specific role because, as you saw from my presentation, the health sector it's huge. It's really big, and there's the private, there's the public. We have all these other players, and therefore I wouldn't say there is as much as the population grows, the demand for health services and good health is grows with that. So I think it's basically all jobs in health, but of course we can't ignore the fact that digital transformation in the past decade is something which has really grown, and the appreciation and the need to take advantage of digital innovations in delivery of healthcare. So that could be one of the places maybe I can mention. And I gave examples for Kenya. A few years back, we didn't have the Digital Health Agency. It's a whole organization with with so many employees and all this. All those are new roles which have been created. And I'm sure if you grow across all sectors, the demand for digital transformation has been on the rise in the past, decade or several decades. So I can give that as one of the examples. But really, I think across the health sector, the demand for all these roles has been there because as population grows, you must remember that just like education, the demand for health services grows, and therefore the need for more people to work in the health space grows. I can tell you one statistic. WHO projects that by 2030, we'll have a shortage of 5 million people required to work in the health space in Africa. What does that tell us? The World Economic Forum projects that over 100 million jobs globally will be created just from AI. Of course, tens of millions will be lost, but also from an AI forum earlier in the year in Nairobi, there was the statistic of 45 million new jobs created in the next decade in Africa because of AI. So those are some of the things to know. And I'll encourage you to visit World Economic Forum and see some of the jobs for 2030, the near future, and learn about them and see what additional skills you need. Thank you.
Okay, thank you, Vivian. Someone wanted the secret sauce. No, there is none. Just focus on your field. Place yourself in the right rooms, right opportunities, and go out. Put yourself out here. I can't see any other question, and I think I will invite Teresa to just tell us a little bit where we can find or how we can subscribe to the Healthcare Rising newsletter. And then we will be winding up. So please, if you have any question or if you feel there's something you need to address, drop it on the chat box. Teresa, on to you. How do we get access to the Healthcare Rising newsletter? You can as well drop the link on the chat box. Yeah. Teresa, can you hear me?
You will need to unmute her, Rispa.
Okay. Okay. How did I mix up the main name? Yeah, here we go.
Thank you so much, Rispa. So that was I made you the host and then I forgot to make myself the co-host. Thank you so much for joining the webinar. So you can subscribe to Healthcare Rising, and I'll just share the link in the chat box. And like I mentioned when we started, we have jobs that we send out. We curate jobs every month from like 50 openings to 150, and always 40% of those jobs do not require you to have formal training in healthcare. They are for other roles, but also for healthcare roles if you're looking for healthcare specific roles. So you can subscribe to the newsletter and then you'll get this in your inbox. Thank you.
Okay, thank you, Teresa. I can see the link. Just paste it. Yeah, I don't think there is any other question. And so with that, I think we will just wind up. Thank you so much to everyone who made time to be here. Thank you to our guests. But before that, anyone with anything before we wind up? That is, and no, everyone is satisfied. It's okay. Thank you so much for making time to be here.
Just as we wind up, also I just want to say a big.
Okay, Pauline.
Can you hear me, Rispa?
Yeah, I can. You can.
Yeah, as we wind up, just to mention a few things. I have heard Dwayne mention about, he talked about a portfolio, that you need to have a portfolio. Make sure that you're always checking your inbox for the 3 days of every week for our Green Jobs Rising newsletter, because those are the things that we talk about in our newsletter. So if you want to know more about the portfolio, we did that newsletter last week. So you could actually just go back and check on it and know more about a portfolio and how to do it and how to improve your chances of getting that job with a portfolio, and which roles actually do need a portfolio and which ones that do not necessarily have to have a portfolio. So yeah, just keep in touch, make sure that you're always reading them to help improve your chances. And also if you have something that maybe you want us to feature in the newsletter, please always reach out to me. How can you reach out to me? You can always reply to any of the newsletters and I get the email. So thank you so much. Back to you, Rispa.
Okay, thank you, Pauline. Yeah, the Green Jobs Rising newsletter is a gem. It's like a free pass or like a guide to whoever is looking for a job opportunity, what you should be doing, where to find the courses. It's literally a guide. Yeah, and I don't think there is.
Can I say one thing, Rispa, before I go?
Oh yeah, sure, Vivian.
Just to take this opportunity to thank the team. I'm impressed that it is such a young team, and I think you should also encourage the rest of the participants in this webinar that it doesn't have to be a formal employment. It could also take some bold steps like what Healthcare Rising is doing. a really commendable job. I'm impressed that it is such a young team of young ladies. So keep doing the good work. Congratulations on that. Thank you also everyone for joining this. I hope you got something which will help you as you build your career.
Thank you, Vivian. Thank you. I don't think there is anything else unless Dwayne has something to tell us. We have like 3 minutes.
Yeah, I guess to wrap up, just have genuine interest, build sector knowledge. Some of the things Vivian has touched on, or some of the questions people have asked Vivian, like which sector is growing, you can, if you have genuine interest in that sector, green jobs rising, green health, right? Sorry, which one? The new one is called health rising, before I call it green health. Articles like this will let you know what's happening, what jobs are growing, what companies are setting up in Kenya, West Africa. So just genuine curiosity for the sector you're interested in will give you way more information than some of us can on this call. Sometimes we don't know what's happening. There's a lot happening, but signing up to such newsletters, going to these forums, general articles online will help you, podcasts as well. It will tell you what people are looking at and what's interesting, or what other subsectors are coming out from the main sectors. So yeah, just keep yourself informed with your areas of interest.
Okay, thank you. Thank you so much, Dwayne. And thank you so much to our guests, to our participants. I hope you've learned a thing or two. And I hope you, going forward, you're going to be bold and pursue whatever field you're in this healthcare sector. So yeah, bye.